Hello, this is Dr. Gay from First Look MRI, and this is a 51-year-old female who's had shoulder pain for about 9 months. She's had no history of prior injury, and on this view on the left, this is called a T2 weighted view. The subcutaneous fat is bright, the bone is bright. This is the round humeral head, this is the humeral neck, humeral shaft. This is the glenoid, this is the medial part of the joint, this is the lateral part of the joint. This is the shoulder joint here. Above we see another joint. This is called the AC joint, or the acromioclavicular joint. We got the clavicle along the medial side, and we have the acromion process over here. And between the acromion and the humeral head, we see this dark band, which is part of the rotator cuff. This is a muscle, supraspinatus muscle, one of the rotator cuff muscles, and it comes sideways here or horizontally, and it turns into a dark tendon here, the supraspinatus tendon. So there's no full thickness tear of that rotator cuff. This is towards the back of it, is the top of it, and those look good on this view. I don't see any fluid in the joint. This is called a fat suppressed protendensity view, and fluid would show up as really bright here. I don't really see any fluid in the joint, so that looks good. And if we look on another view here, we're going to see in the axial plane, the front of the shoulder, back of the shoulder, outside. This is the medial side. Again, we see that round ball of the humeral head looking great. This is the cup it sits in, the glenoid looking good. I don't see any labral tear, any sniffing abnormality on this. So the question was, well, what is going on? So if we look really carefully, we do see a finding on these two views. They're not really apparent on the other views, but on these views, these are very sensitive to fluid. Now we're going to really increase our sensitivity and look, do we see any fluid? And sure enough, right up here, the AC joint has a little teeny bit of fluid, really some minimal AC arthropathy or arthritic change, or just really minimal. We can find that on this view if we take this line all the way up to the AC joint. And here it is. This is the clavicle, this is the acromion process, and a little tiny bit of degenerative change at that AC joint, very minimal. But I do note that there's a little spur right here along the bottom of the clavicle. This is the clavicle. This is the very bottom. There's a tiny little bump down here. And if we look beneath that, we see a black line. This is the supraspinatus tendon. This is the muscle that's gray. The black line is the tendon. And you can see the tendon is pushed down just ever so slightly by this minimal spur. So it looks like they may have some very mild AC or acromioclavicular degenerative change, and a tiny, tiny spur here that just happens to push down a little bit on the rotator cuff as the rotator cuff goes underneath the AC joint here. And also on this view, we zoom back, there's a little white line over the surface. That's a little bit of edema. We call that peritendinous edema, or a little developing fluid collection in the bursa. And over here, there's another little black line or white line here. This is a tiny, tiny amount of fluid in the subacromial subdeltoid bursa. So the bursa goes over the top, covers the rotator cuff, and that bursa is inflamed. And there's a little bit of fluid in that bursa. So this is bursitis. And again, we do see that little bony spur that pushes on the rotator cuff. The rotator cuff is not torn. It just has mild bursitis. There's a little bit of increased signal right here, maybe some mild tendinosis or irritation. We call it tendinosis or tendinopathy of the rotator cuff. But there's no full thickness tear. And that's it. So the problem is related to a tiny spur, likely, that may be pushing on the rotator cuff. When they move their arm, this glides along and rubs along the undersurface of this bony spur. And the inflammation, there's some inflammation in the bursa, we call bursitis, and a little tiny bursal effusion here. Again, no full thickness rotator cuff tear. So they'll probably treat this conservatively. If things got worse or they had significant problems, sometimes they can shave off the undersurface here, that little bony spur, and hope that that solves the problem. But luckily, no other findings are here, just a mild bursitis, maybe related to impingement by this bony spur. Thank you very much.